straight route to being told that you have a diagnosis of MS. I think there's a lot to take on board at that time, and and we're going to be able to go through some sort of concepts today that I hope will be helpful. So we'll move to that next slide, please. I guess no one really thinks when they get a long-term diagnosis that in fact that has anything to do with having superpowers, but you do have superpowers that we will discuss. And just as a quick hint, they're all about how you manage yourself and how you communicate with other people. We're going to talk about you being the CEO of your own life. And when you're the CEO, you don't need to know everything, but you do need to build a really good team. And we'll talk about how best to do that. We'll touch on relapse recognition and what a relapse is, how you know that perhaps you're having one, and what to do next. Brain health is something that if you've met me, hopefully I've talked to you about, but it's a big movement now, and certainly MS Auckland and our community advisors speak a lot about brain health as well. If you are listening from out of Auckland, I know that my MS nursing colleagues up and down the country also talk about brain health, and it's a great thing. It's exciting because it's something that you can take control of. It's not a medicine. It's about decisions you make in your everyday life, along with MS and diet. We'll talk a little bit about exercise and core strength. And if you could see me right now, I'm sitting up and holding in my stomach, thinking that my core strength is quite as good as it could be. And we'll touch on mood and sleep as well. So if we go to the next slide, please. Your superpowers. The super S's, I call them, and that is about self-management, how you're going on a day-to-day basis. So self-management is something that I really want every single person I meet in clinic to consider. The way you manage yourself has such huge impact and roll-on effect to daily life. So we've worked with lots of people around Auckland to develop some guidance on how to best self-manage. And along with self-management, you need to know how to advocate for yourself. I love it when people email or call me and tell me that everything is going beautifully, but more often than not, being human, we just get on with things, don't we, when things are going well. So actually knowing how to advocate for yourself when you're struggling is actually something to practice. And I think it's much harder actually than it seems at times. Next slide, please. So I mentioned earlier about the A team and you being CEO of your own life. And I think you want your life to be so much better than Richard Branson's or Jeff Bezos's. Now, those people will just pretend your life is as big as Amazon. They don't know everything about their chosen business. And you know everything about your life, but you may not know everything about MS. This is new to you, right? So as a CEO, you are the boss, you get to make the decisions, but you can have a team of experts who you select, your board of directors. So you've got your family, you can co-opt them in immediately. And then you've also got your neurologist who most likely, in fact, it's almost impossible to get a diagnosis of MS without having met a neurologist. It's a little bit difficult to hire and fire neurologists because they've got a limited supply of them in the healthcare system, but there are ways of getting second opinions if you're able to utilize private practice, which is out of the realm of the possibility for many of us, but certainly you want to feel that your neurologist has got your best interests at heart. Depending on where you live, you will always have access to an MS nurse. Northland Northland unfortunately doesn't have a specific MS nurse, but the rest of the country geographically have MS nursing posts. And I think having an MS nurse is really important because you're then plugged into the system. We are your conduit through to your neurologist. You can ask us questions that we can either answer or if we don't know the answer to, can pass that on to your neurologist. So we're a good person to have on your team, on your board of directors. And if you haven't met your MS nurse yet, find out who he or she is and interview them for your company. Your GP is really, really important, and it is a difficult environment at the moment for GPs. It's hard to get continuity, and a lot of people would tell me that they'll see a different GP every time they go into the surgery. And let's face it, actually getting a GP appointment at the moment is taking weeks, right? So get to know your GP and try and find someone who works for you, um, because most GP practices don't have a lot of people with MS at their practice. You may have to educate your GP a little bit about MS, and actually, that's okay too. They don't need to be experts because you've got a neurologist and an MS nurse, but they just have to listen and be interested in what you're saying. Physio and occupational therapists and other people in the community are really important, but almost the next most important, perhaps way back at the beginning, is your MS community advisor. So please, if you don't know your community advisor, find out who they are. You can refer on the MS Auckland website, and you'll be contacted by one of the team. I feel like as the MS nurse at Auckland Hospital, we work so closely with our community advisors. I feel like they're the jewel in the crown of MS Auckland. So if you've not met yours, I really strongly advise you to make contact. And actually, making contact with people can feel quite overwhelming when you've got this new diagnosis. And you'll see on my next slide, sometimes communicating with people, particularly people when you're talking about your own health, can feel like a big deal. And sometimes it's hard to know if people are listening. So it's good to practice. And talking to medical people sometimes can feel a little bit intimidating. They're not all as good looking as some of the people on this slide, and hopefully they're all older than Doogie Howser. But I thought we could talk about some tips regarding how to get the most out of your medical appointments. So you will have seen a neurologist by now, and maybe an MS nurse, but you will have follow-up appointments going forward. And these are not long, they're 25 minutes. That's the allocation you get, if you're lucky, every 12 months. If something significant is going on, we might get you an appointment at 6 months, but the system at the moment is at breaking point, and 25 minutes every 12 months isn't much. So I am all about being strategic, and I want you to think about being strategic. Bring a list with you, and be cognizant, I guess, that you might not get through your whole list. Pick your top three concerns. And if you're in Auckland and you want to, you can give me a call or drop me an email first, and we can look at your list and see if there's things that we can take off it by talking to me or Nazila. And so we can really hone down the key things you want to talk to your neurologist about. I'd also suggest that you bring a friend or family member with you. 2 sets of ears is always good, I think. And if you're calling or emailing me, I love it when people can put their identifying details into the message. So your NHI number really helps me help you faster. It means I can get into your notes and sound a bit more smart when you contact me. Otherwise, you've got a bit of a delay in how quickly I can solve your query. I love it in an email, bullet points rather than a long essay, just because I'm getting more ancient now and I have to wear my glasses to read my emails. So yeah, brevity and bullet points is a great way to communicate with your medical team across the board. Um, and then there are people sometimes who call us and they don't leave a message, but they'll tell me they've called a number of times. So help you to help yourself by letting us know that you've called. We don't have powers of ESP. We don't know when people have called if they haven't left us a message. I know that sounds really simple, but you'd be amazed how many people don't leave a message. When you are contacting us, it may be because you're having new symptoms. And we very much want to get back to you very promptly if that is the case. So if you let us know in the title of your email, question mark symptoms or help or I'm having a relapse, anything like that. Same thing on the telephone. If you mention that you think you're having a relapse or new symptoms, you go to the top of the call back list or the top of the email reply. You're our priority. So have a look at this relapse tool. It's also, I believe, on the MS New Zealand and maybe MS Auckland website. And I'm happy to send you a copy. I guess it's important to consider if the symptoms you're having are new to you, completely new, or if they feel a little bit familiar. So the definition of an MS relapse is new or old symptoms lasting more than 24 hours in the absence of a fever. So we know that increased body temperature caused by an infection, caused by stress, can bring back old symptoms. And we know if it's what we call a pseudo relapse, that this is something that won't last. If you treat your infection with antibiotics, or if you've been in a sauna or a spa bath, which has pushed your body temperature up, the symptoms that you have had in the past that may have come back will go away when you cool down. We know that a true relapse doesn't come and go. It sticks about often for weeks. So if you've got any signs of changes in vision, altered sensations, you feel dizzy or weak, and this is going on for more than 24 hours, please get in contact with us. We want you to talk to your GP as well, but as we just mentioned earlier, it's really hard to speak to GPs at the moment. So we're at work Monday to Friday from about 7:30 till 4 p.m. Don't leave it till 4 p.m. to call us. If you're feeling unwell, get on the phone and let us know, and we'll make plans with you about what to do next. So, as far as getting help, when you speak with us, we'll try and work out, is it a pseudo relapse, a relapse that is not indicative of new inflammation on your brain and spine. It's old inflammation just rearing its head, and we can work out how to manage that. So if you're not sure, as I mentioned, get in contact with us or your GP. We struggle to get you an urgent review at the hospital, and it may take a couple of weeks to get an acute appointment with us. So we will often annoyingly say, can you speak to your GP? Because your GP can then call through to the hospital switchboard and ask to speak to the on-call neurologist. We would never ask you to go and see your GP if your symptoms were really mild. If you've got tingling in your fingertips, but it's not changing your daily life, we would do something we describe as watching and waiting. And we'd get you to contact us every couple of days or once a week to update on your symptoms. If your symptoms were ramping up, then we would move up to the next level of arranging an appointment for you or you seeing your GP. But not every relapse needs treatment. And not having treatment, and the only treatment for an MS relapse is a course of steroids. Not every relapse requires a steroid course. Often, sensory symptoms like tingling and altered sensations, although they're gross and unpleasant, they most often resolve without any treatment at all over time. So sometimes time's actually the treatment you need for this clear up. But we want to know about it. We really still want to know if something's going on. So if we ask you to keep in contact with us, it's not because we're not interested in treating you, it's because we're hoping to get you through this relapse without having to drastically alter life, bring you into the hospital or treat you with a high dose of steroids. And it takes time. It takes time to recover from an MS relapse. So you need to give yourself time. You probably wouldn't run a marathon if you had a cold and a flu and sound a bit like me. So you need to treat yourself when you're having an MS relapse in the same way you would if you were feeling unwell. You need to be nice to yourself. You need to just cut yourself a bit of slack, and if you need to take time off work, do that. Um, and remember, you're not on your own with that. We're available to help you through this time. So that's about relapses, and I wonder if anybody feels unclear about that. I'd love you to jump on my email next week, and I'm happy to talk to you more about that. Happy to arrange a follow-up sort of appointment with you, either in person or via Zoom, because there's a lot to learn at the beginning of this diagnosis. And we totally respect that when you meet us in clinic, it's not always the right time for you to learn things. So hopefully after listening to this today, if you're still unclear about relapses and you'd like to get more clarification, just let me know. So we're going to talk about now brain health and the things that you can do outside of anything medically based or medication that can help you keep your brain and spine healthy. So there are things that you can do, and these include keeping as active as you can. This doesn't mean you need to start doing multi-sport events or Ironman championships, but it's just getting up and out there in the world, looking at your step count, making sure that you're doing what the Heart Foundation would suggest, which is some exercise 2 or 3 times a week. Um, as you get older, apparently after 35, we should all be lifting some more weights to help our bones. Um, if you are someone who has got a very expensive clothes horse gathering dust in your room that actually is an exercycle or a treadmill, consider dusting it off, please. You don't have to sit on your exercycle or treadmill for long amounts of time. Even just doing 5 minutes a day and building up would be great. I always suggest to people that they put their exercycle right next to their TV and make sure that they can find a program they love. So you can watch your series and get some exercise at the same time. If you don't have an exercycle or anything like that, you can guarantee if you get on Trade Me that there are lots of other people who've invested in such things and would love to get rid of them. So you might score yourself a total bargain. Uh, I'm sure most people, hopefully, out there in the world aren't smoking anymore or vaping, but we have to be realistic. And it's really hard if you're a smoker or a vapor to actually give up. So if that is you, maybe think about talking to smoking cessation people. Happy to refer you through. There is evidence to suggest that smoking can make people's MS worse. So something to think about. I'm not nagging you, but I guess if that's you, you kind of know it's something you should be trying to reduce anyway, right? Watch how much alcohol you drink, please. That's not saying don't drink anything at all, but just be mindful about alcohol-free days and sticking within the guidance for alcohol for your gender per week. Um, the brain health movement suggests keeping your mind nimble, which can include lots of things, right? I got on Duolingo with one of my daughters this year and spent 160-day streak learning Japanese. Now, I don't know if that helped my brain health, but I really like to think it did. So things like that that are extending your everyday kind of thinking. Maybe it's learning to salsa dance. I don't know. Lots of options out there. But those are all things that the brain health movement tell us is good to keep our brains lovely and plump. And we know with MS that we lose brain volume, and anything to keep your brain volume up is definitely a good thing. It's also looking at your weight and making sure you're in a healthy weight range. So if that's something you're struggling with, again, talking to your GP about methods to stay within your weight range is something I would encourage you to do as well. There's a lot of information out there in the world, and some people at diagnosis can't help it. It's pretty easy to go down a research rabbit hole. And I would encourage you to consider the methods you're getting your information from out there in the world. There's some really great, reputable websites available, and I'm very happy to share these with you. And I'm sure Catherine and Luminita and Penelope, Nicola at MS Auckland would share these with you as well. Stick to the bigger, more reputable sites, MS New Zealand, MS Auckland, MS Society UK, MS Trust UK are all really great peer-reviewed, medically reviewed websites for people with MS. Dr. Google is someone we all know, but I think there's a lot of misinformation out there as well. So just be careful that you check the sites you're looking at, that you're getting your information from if you are a researcher. My favorite site to recommend is the Menzies University site because they have spent a lot of time over there in sunny Tasmania putting together a really wonderful course for people with a new diagnosis of MS. And knowledge is power in this case. They have made a couple of new courses now. One of them is about disease modifying therapies. There's one about aging with MS and also MS and mental health. These are free courses that you can enroll on. And the next one's coming up in September. So, from what I understand, applications or signing up is happening right now. So, at the end of this webinar, if you haven't signed up for the next course, please consider doing that. Otherwise, you'll then need to wait till March, I think, next year. There is a number of different factors, I suppose, is the best way to describe it. So it talks about the pathophysiology of MS and what's occurring when you have a relapse, right on through to perhaps things like pregnancy and MS, lots and lots of different topics, different symptoms, anything you can think of is kind of covered in this course. So we all really like it and would hugely recommend you having a look at it. There are lots of videos on the course from neurologists around Australia, people with MS around Australia, MS nurses, and you can take it as slowly or quickly as you would like to. Also really good to share with your friends and family. If you've got a very worried parent or partner or great Aunt Mildred who is always asking you how you are, you could recommend that these people also do the course. On the course, they will talk about lots of things, and I'm sure MS and diet is also covered. You may have even done a little bit of Googling on MS and diet, and if you have, you've probably learned that it's quite a big area, but it's also an area that's quite confusing. There's no right or wrong when it comes to diet, but there is certainly a framework of guidance we can provide. The main theory is reducing saturated fat in your diet, looking at having some vegetarian meals or a combination and some more white meat and less red meat in your diet, and increasing your levels of something called linoleic acid, part of the omega group. So we know that flaxseed oil has wonderful sources of omega. It's something you can add to your salad dressings come summertime, and that can't come fast enough. For me, there are lots of kind of competing diets out there. One of them is the OMS diet, which if you look up is a really great website. It's a UK charity. And they have some really good podcasts, by the way. And my favorite podcast, I'm going off track here, but my favorite podcast is about vitamins and MS. I think it's number 9 of the first series, and it's by this nice Irishman called Connor Curley. So he talks about vitamins, but the OMS diet itself is actually something that was put together by a guy in Australia, an emergency doctor called George Jelinek, and it focuses on a uh, a diet that is vegan, which is pretty hard if you're a keen barbecuer and a New Zealand man, I suppose, which is an unfair thing. But my husband loves his Weber, so um, but I think there are people who feel wonderful when they're on this diet and they've got improved energy levels and all sorts of things. So it's something to definitely look at. There's the Wolves Protocol, also the Swank diet and the Paleo diet that people have also found really helpful. Looking at all the different diets, it's usually a combination of things that lead to the Mediterranean diet that people find really helpful. So I'll let you do your own research to bear some of those diets in mind. There's also an excellent recording of, I think it's still on the MS Auckland website by a nutritionist called Katie Boyd, and she talks about MS and diet. And I think she's definitely worth a listen to. In the end, this is the one thing you take complete control over. So it's something that's worth thinking about. Oily fish would be the other thing. If you can get more fish into your life, it's only going to help your MS. So find a friendly fisher person. Hopefully, your next door neighbor has a boat, and tell them that you need all of their leftover snapper. So enough about diet. We now better talk about core strength and a little bit about exercise, I suppose. So my favorite thing to recommend to people is actually Pilates. Um, but I'm kind of aware that getting to a Pilates class isn't straightforward. It isn't free, but it does certainly really improve core strength. There are ways to help your core strength that will cost you absolutely nothing. Um, and and I think the best and most reputable and well reviewed is probably Adrian, who does her yoga online for free. She does different challenges for different amounts of time. And she is, of course, a classic, beautiful, slim yoga instructor from America. Um, and I think having that element of yoga that gives you a chance to meditate is a good thing as well. So there are yoga and meditation videos on the MS Auckland website. And if you speak to anybody at an MS coffee group, you may find that they have local recommendations for yoga and Pilates instructors. Um, there's a great article from a few years ago by one of our members called Margot, who has spoken about her instructor, and you could have a look at her. I talk about it a lot because having a strong core actually literally helps your balance and keeps your muscles strong, keeps your glutes strong. You want to be able to feel like you can take on the world no matter what. And I think as time goes by and the busier we get and the more we sit at computers, the more important it is to have a good strong core, um, and to look after our backs, no matter what age you are. As time goes by, this is something that you need to be sort of focusing on. In fact, that's for anybody out there in the world who's listening to that. You don't have to have an MS diagnosis to fully be considering looking after your core. I don't mean that you need to have ripped abs like Arnold Schwarzenegger. It's just keeping working on that part. And while we're thinking about exercise, often doing exercise makes us feel good. Those little endorphins that come from exercise are something that we want to chase if possible. Uh, Unfortunately, there's research that supports the fact that people with an MS diagnosis are more likely, percentage-wise, to go through an episode of depression, which makes me feel sad. But I think this is something to bear in mind, and there are lots of support out there if you're feeling blue. I would definitely recommend the depression.org.nz website if you are feeling like you've got any signs of anxiety or low mood. There's some great questionnaires there, and of course, John Kerwin is their poster child, and he's done such a lot to um, give us the ability in modern life to actually talk about how we're feeling a lot more. The stigma of saying that we're feeling sad or depressed or thinking about taking antidepressants has really been removed, which I think is so wonderful because it's quite normal to have ups and downs in life and ups and downs in the way we're feeling. And there's absolutely no shame in getting some support to get through that. So, if you are, after your diagnosis, feeling understandably a bit up and down with your mood, speak to someone about it. You know, talk to your family, come along to an MS coffee group, and you can find out where those coffee groups are if you look online at MS Auckland's website and inside their publication. There's also a list of where the coffee groups happen across Auckland. But actually speaking to someone else who kind of gets it can really help sometimes. Your GP can refer you for counselling, um, and you can speak to someone professionally about how you're feeling. They can also talk to you about options for treating your low mood if it really is a low mood. Sometimes long-term or short-term antidepressants can be actually such an important thing to consider. There's also some really incredible people with MS who have volunteered their time to be peer support members for MS Auckland, and I just adore this service. So I often mention to people I meet in clinic that perhaps they might want to consider speaking to someone from a peer support perspective. You can talk to me till the cows come home, but I don't have MS. And I think sometimes speaking to someone who's been there, like having a MS big sister or big brother, is really, really helpful. And it can help get people through a really tough time as far as mood and feeling, feelings of hopelessness can lift when you speak to someone else who's been there and really gets it. What we also need when we've got a low mood is to think about the rest we're getting. And I think sometimes we discount how important sleep is. Anybody who's had kids absolutely knows that babies don't sleep all the time. But we always talk about sleeping like a baby, don't we? And look at that little cutie. The way to sleep like a baby who's not teething, ideally, is thinking about your sleep hygiene. And you may or may not have heard of sleep hygiene, but there are things that help us get a better night's sleep. And these things focus a lot on the environment where you sleep. So thinking about not having TV screens in your bedroom or being on a screen before bed can help wind your brain down um, and be more prepared for a good night's sleep if you're not looking at a screen or a blue light in that hour before bed. Was never a better time to join the library and read before bed, which will help. Thinking about the temperature of your room, making sure it's not too hot or not too cold, making sure that it's not too dark and not too light, making sure you don't have significantly huge amounts of alcohol before sleeping, which changes your temperature as your liver breaks down the alcohol, and the temperature then has an impact on your huge heavy meals right before bed make sleeping more difficult. Um, and just looking at some of these options may improve your sleep. Thinking about how much fluid you've drunk before bed, so you're not up to the toilet a whole lot of times overnight. And when you have your last cup of coffee, is also something to think about. Um, I've got a phone, I mean, a watch that tells me what my sleep is like. I'm not sure if I believe it sometimes, but there's lots of different ways. Ideally, getting the sleep you need helps your mood, helps you manage your symptoms if you're having ongoing MS symptoms, and helps you manage life a bit better. If you are having problems with your sleeping, I'd really love you to talk to your GP. They are able to prescribe things like melatonin. And actually, I'm pretty sure now we will be able to buy melatonin without our GPs being involved at all across the counter at pharmacies, which is good news. CBD oil, also another good option to consider as far as helping you get off to sleep. if you're someone who finds that they've got restless legs and your legs are moving a lot overnight, please speak to your GP or to me, because we know actually sometimes restless legs are a sign of something called sleep apnea. Um, and there are assessments we can do to make sure that that's not happening. And sleep apnea is something that needs to be treated. You're a big snorer and your husband or wife is always kicking you in the middle of the night because you're snoring, that could be a sign that you've got sleep apnea. Nighttime trips to the toilet. Now, we did talk about not drinking too much before going to sleep, but also you shouldn't really be getting up to go to the loo more than once a night. If you are, it may be something that you should talk to your DP or to me about. I'm a little bit obsessed with people getting a good sleep and also people not getting up to the loo 100 times. There are definitely things we can suggest to help you control your nighttime bladder, and I would love to talk to you about them if that is you. There's also a great book, Michael Mosley, 4 Weeks to a Better Sleep. You could have a look at that, and there's an excellent sleep calculator uh, website that can help you work out when to wake up and when to go to sleep so you don't wake up in the middle of a REM sleep cycle. So sorry, I have talked on for much longer than I expected. I just wanted to talk to you just a little bit now about considering how best to look after yourself. You want to look at identifying stress. It's hard to remove all stresses in your life, but think about what does give you stress. Really think about it. Then think about how you can actively relax to try and deal with some of these stressors. Think about whether or not you need to invest in a dog to take you out into nature and go walking. Buy that exercise cycle, do some yoga. I want you to be strategic and I want you to know who to call and when to call them and when to I want you to know who to call and about what and when to do it. So if you're having new symptoms, you need to know when the right time to call is and who to call. Um, and then I just wanted to share these websites with you. As I mentioned, there are some great websites out there. MS is definitely annoyingly grey, not black and white. And if you're someone who likes a black and white answers to things, sometimes you won't unfortunately get them. But here are some of the excellent websites. I love Shift MS, by the way. If you're into big research, this is a website that breaks down academic articles and translates articles into everyday life. And actually, sorry, it's called MS Translate. Shift MS, though, is super awesome. And that's a UK based website made by a nice man called George, who has MS himself. But you have a look at those websites, and I am really happy if you give me a call if there's any other ones you were interested in I could recommend. So really, you're stepping off with a new diagnosis, and sometimes this can feel out of your control, and that's a hard place to be at. So after listening to me today, I hope you feel like you've got some aspects of your MS life that you can control. And that's thinking about how to be as well as you can be, as fit as you can be. These are all the choices you can make on a daily basis that are going to help you go forward stronger. And I think it's really important to have the mentality that your body will be around a lot longer than an expensive handbag. So you need to invest in yourself, investing in that Pilates teacher, investing in that new pair of running shoes, think about what you can do to keep yourself as well as you can, and feeling good. Yeah, so thank you for listening to me. I'm really happy to take any questions if there are any.
Thank you so much, Fiona, for that talk. There was really just so much there. I particularly liked the the clarification on symptoms, and what to do and when, and what those kind of criteria are. I also really liked that you mentioned that the community advisors are the jewel in MS Auckland's crown, because 100% they are. And I think the fact that MS is such an individual condition means that, if you have a community advisor who understands how MS works in your own life, and can help you with a roadmap that's unique to you, and putting all those services in place, and that's fabulous. Thank you, Fiona.